Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the iClearScope endoscope. And we have here a patient who attended with bilateral occluding earwax. But the earwax in both ears differed somewhat. So in this, their worst ear, their left ear, the wax plug was quite dry and coarse, whereas the right side, it was a softer and stickier consistency. In addition, the entrance of this ear canal is far narrower in comparison to their right ear. So I'm just using the right hook here, and I was hoping that as I embed into the core, which I have managed to do, as I was bringing this away, it'll extract this whole plug out of the ear. However, the core is a bit more crumbly and short, so if you think about a short crisp biscuit. And so I've decided to revert back to Microsuction. And to facilitate, I've just put some medical grade olive oil, and I'm hoping this will soften the surface enough so I can get a better suction grip. And I'm also hoping that it helps to lubricate the canal wall. When you've got something dry and coarse like this, bringing it out of the ear, there's a lot of friction. The surface is like sandpaper, so some patients can actually feel it being extracted, and it can be slightly uncomfortable. So the oil also helps to make it a bit more comfortable for the patient. And you can see just how narrow and collapse even the entrance is. So there might be a bit of a case of a collapsed canal here. So the canal entrance can collapse for two reasons. The cartilage itself can just weaken over time, and as a result, gravity takes its effect. So it causes a droopiness of the cartilage. So the outer third, remember, is made up of cartilage, but sometimes the cartilage can continue to grow. And as it overgrows, it kind of, because of the additional length and the weight, it kind of can fall over it upon itself and somewhat shut the entrance. And when you've got someone with a collapsed canal, they can quite commonly suffer from earwax impaction because the wax is no longer able to naturally migrate out of the ear as it should. So I've managed to loosen this, and I'm just about to trying to wriggle this out. If you watch till the end, there's a still image of these wax, and I would say there's a lot of dead skin content. So earwax typically is made up of 60% of dead skin. I would say this has got a high concentration. So sometimes when I refer to a wax or keratin plug, they kind of like it's the same thing as such, apart from when you have keratosis obturans, when you have a dead skin plug, that's slightly different because the layers of skin, they're like an onion structure. So the individual skin cells are still interconnected, and you have sheets of dead skin that kind of form into a plug. So I managed to remove that. You can just see how dry the surface of the skin is there. And you can see some dead skin kind of being kind of flaked away. So that's the skin that was surrounding the wax and keratin plug that was still adhered to the canal wall. So you can see here the consistency is completely different. It's soft and sticky. I actually much prefer when it's drier and harder because quite often you can extract that in a large singular piece. So I've used oil, but this is to almost coagulate this sticky, soft wax together, so it has a different function. Whereas I used it in the left ear to soften the surface of the plug, here I'm using it to almost coagulate this sticky wax, and also to help lubricate the inside of the suction tube. So quite often when you've got sticky wax like this, as you're suctioning, as the wax is travelling up the tube, it can block it inside. So I just find it helps to prevent blockages, just using the right correct. See, I tell a lie, they do actually have quite a narrow ear canal entrance here. So an ear hook is not going to work in this side. The wax is just too soft and squidgy, if you like. So I'm just using the right correct there. Just clearing the entrance. And again, I'm just using the angled correct. Just find it's far easier to insert. Your hands don't cross over with the endoscope, or if you're using specular, it doesn't cross over. So you have better manipulation. So I'm just dilating the ear canal entrance there. So I've just reverted back to the suction. I'm just going to go to the bottom. When you've got sticky wax like this, one of the things you need to be careful of when using a correct is that you can smother and spread this soft sticky wax. So to avoid that, I've just gone back in with the microsuction from the floor of the ear canal. I've lifted it up, so it's now going to come out in a plug, which is always nice. Just going to visualise the eardrum. So at this stage, the patient still felt that they weren't hearing so well. Still felt blocked. And don't know if you have noticed, but there's some oil, residual oil, that's got trapped in the inferior recess. So I don't know if you can see that. And I'm going to clear that away. It can be hard to spot, actually, especially when it's when you're using a clear type of drop, so it's transparent. Oil typically it's got a slight yellow tinge about it, but still it did camouflage itself really, really well. So I'm just using the fine end suction probe. I just want to get in that anterior recess. You can probably see that fluid being suctioned away. And that was much better for the patient. So they're the wax and keratin plugs from both ears. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.